Hi, I'm Dr. Larry Malerba, and welcome back to the All Things Homeopathy Materia Medica series. Today I'll be talking about Gelsemium sempervirens, a homeopathic remedy made from the root of the yellow jasmine plant, also known as yellow jessamine or Carolina jessamine. Once considered to be a member of the Loganaceae family, it's now botanically classified under the Gelsemiaceae family. Although gelsemium is an invaluable remedy for many acute conditions, it's sometimes overlooked for its role in treating chronic health problems, especially neurologic conditions. Gelsemium is primarily a nervous system remedy. All right, let's get started.
Okay, now, if I had to summarize the essence of this remedy, I would say that it fits people who shrink back or recoil into a state of fatigue, weakness, fear, and trembling, especially after facing a challenging ordeal or frightening situation. Although this is somewhat of an overgeneralization, it does sum up many aspects of this remedy. Unable to cope with a challenge, Gelsemium instead collapses into a frightened state of sleepiness and or weakness. And this fatigue or weakness can be felt on any level, physical, mental, or emotional. And the intensity of these symptoms can be anywhere from mild to severe. So when fatigue worsens, it becomes exhaustion, and in more extreme cases, it can manifest as prostration. Likewise, when weakness intensifies, it can cause trembling of muscles, and in more severe cases can manifest as partial paralysis or paresis, and ultimately paralysis. Similarly, one may experience mild drowsiness or moderate sleepiness, and in more extreme cases, overpowering sleepiness. Gelsemium can be the remedy of choice for symptoms anywhere along this symptomatic spectrum. So we must think of gelsemium when a person can no longer cope with a situation that either frightens him or is too stressful to face. Such situations can range from the mundane, like a school exam, to the profound, like a violent encounter on the battlefield of war. Gelsemium is a remedy for both test anxiety and soldiers with PTSD. Although the two situations are vastly different, gelsemium may be needed, especially when the response to the stressor is similar. In both cases, the person feels unequal to the challenge. He loses his courage or loses his confidence and becomes paralyzed by fear. He can no longer cope, he gives up, and wilts under fire, so to speak. A good way to characterize it is that he loses his nerve. His will to action fails him, and he instead trembles in fear, becomes weak and tired, and wants to crawl into bed in order to avoid the reality of his circumstances. In earlier times, traumatized soldiers were said to have shell shock, battle fatigue, or combat fatigue. Such individuals would return home and have a hard time adjusting once again to civilian life. Some confined themselves to home, and many had trouble keeping down a job. I once treated a very successful middle-aged professional who had been embarrassed and humiliated in front of a large group of his colleagues. He went home, climbed into bed, and never returned to his job. It wasn't until a year later that he consulted me. He had spent most of that year lying in bed, feeling exhausted, and sleeping the hours away. A few doses of gelsemium got him quickly out of bed and on his way to recovery. The homeopathic literature often uses the words coward or cowardice to describe gelsemium. And while I understand that these words are intended to be descriptive, they are a bit harsh. One definition of the word cowardice is, quote, a shamefully excessive fear of danger, difficulty, or suffering. For this reason, it can be interpreted as passing judgment, as if to say that the person should be ashamed of his affliction. And we as homeopaths should understand better than most that blaming, shaming, or passing judgment are absolutely incompatible with healing. Okay, now back to our remedy. Gelsemium's lack of courage or loss of nerve can manifest in a variety of different ways. It can take the form of a general lack of confidence, and some may describe themselves as shy, reserved, nervous, or timid. Of course, Gelsemium is famous for its use as a performance anxiety or stage fright remedy. I'll never forget the time years ago when I was asked by my friend, a Jungian-oriented psychiatrist, to speak about homeopathy to his study group of fellow medical professionals. I was thrilled to have been asked, but as the date approaches, I became increasingly anxious. About half an hour before the event was scheduled, I decided to take a single dose of Gelsemium. I delivered my talk, which was very well received, and only when I was walking out to my car afterwards did it dawn on me that I had been calm as a cucumber. Not only did Gelsemium work, but I'd completely forgotten about myself and my own personal worries. Gelsemium is a remedy for both acute and chronic cases of test anxiety, interview anxiety, stage fright, and performance anxiety. Whatever the circumstance, if a person feels unable to face a challenge or paralyzed by fear, then we must consider Gelsemium. Some describe it as a feeling of nervous dread. Others characterize it as anticipation anxiety. It often takes the form of a fear of appearing in public, or a fear of new situations, or a dread of having to face anything that is perceived as an unusual ordeal. Furthermore, as a practitioner, it's important not to be fooled. Some people are very good at concealing their vulnerabilities, while others are not. So for some, the Gelsemium fear and nervous dread is overt and obvious, but for others it may be concealed and harder to detect. And sometimes the interviewer uncovers a clear-cut etiology after which a person's difficulties began. But it's also not unusual for the patient history to reveal no such triggering event. Perhaps a case of stage fright developed after a particularly negative review from a critic. On the other hand, there are many performers who have always had stage fright from the beginning of their careers. The following rubrics, under which Gelsemium lists prominently, gives us a sense of the diverse circumstances that can bring about a Gelsemium state. Ailments from anguish, ailments from anticipation, ailments from the death of a loved one, ailments from embarrassment, ailments from fright, ailments from grief, ailments from mortification, ailments from bad news, and ailments from shock. And it's not the triggering event itself as much as it is the response to the triggering event that points us to Gelsemium as a possible remedy. I once received a phone call from the mother of a patient who had come down with the flu. It struck me as a bit unusual because it was summertime. In addition to the fact that the daughter had symptoms that pointed to Gelsemium, I knew that Gelsemium had a reputation for fitting flu symptoms that occur in the summertime. Nevertheless, it's important to be thorough, so I asked the mother if anything unusual had happened in the days leading up to the daughter's illness. She confirmed that yes, the daughter had had a piano recital the night before her symptoms began. Not only that, but she'd been quite nervous about the recital. So in this case, it's reasonable to conclude that the triggering event, the recital, had led directly to the young girl's flu-like symptoms. Thankfully, a couple doses of Gelsemium brought her right out of it. Now, the Repatory contains a good bit of crossover between Gelsemium's ailments from rubrics and Gelsemium's fears. Gelsemium fears include the following: fear of exams, fear of failure, fear of an ordeal, fear of public places, fear of appearing in public places, fear of losing control, fear with heart complaints, fear that the heart will cease beating unless constantly in motion, fear of heights, and fear of falling. Now, in addition to anticipation, fear, and exhaustion, the Gelsemium type can sometimes become apathetic or indifferent to his own condition. This is often experienced as a type of depression. When grieving, Gelsemium may be unable to cry. It lists prominently in repertories under silent grief. Sometimes there's a desire for company and support, but in other cases there's an aversion to company with a desire not to be disturbed. When fatigue and weakness affects Gelsemium on the mental level, it can manifest as forgetfulness, dullness of thinking, or poor concentration. Likewise, there may be vanishing thoughts that are aggravated by mental exertion. The person may feel helpless due to his feeling of brain weakness, and this in turn can lead to a general aversion to mental work. All right, now let's talk about the Gelsemium generals and modalities. Generally speaking, Gelsemium symptoms tend to develop gradually. It's not a remedy for sudden paroxysmal symptoms. And generally speaking, Gelsemium tends to be on the chilly side, especially during acute illnesses. Conversely, and somewhat surprisingly, Gelsemium is most aggravated by the summer heat and hot, humid weather. Recall that it is the main remedy for the summer flu. By the way, it's worth noting other remedies with this odd combination of characteristics. Additional chilly remedies that are noticeably aggravated by hot, humid weather include carbo-veg, sepia, and silica. In terms of food and drink, the only real standout characteristic is Gelsemium's notorious lack of thirst. And the thirstlessness is most apparent during acute illnesses. This is such an important clue that if an acutely sick person is thirsty, I hesitate to prescribe Gelsemium. Now, as we've seen, in terms of modalities, Gelsemium can be aggravated by fright, bad news, anticipation, dread, and any kind of unusual ordeal. It can also be worse from anxiety, anger, shock, and even excitement. And as already noted, Gelsemium is worse from the heat of the sun and is worse in hot, humid weather. In terms of time modalities, Gelsemium has an aggravation of symptoms at 10 a.m. On the flip side, Gelsemium is better from perspiring and has a unique keynote amelioration of symptoms from profuse urination. For example, if a person notes that his migraine headaches improve when he begins to urinate a lot, then we must think of Gelsemium. Okay, so on the physical level, Gelsemium conditions are often associated with a great deal of fatigue. In fact, it's one of the main remedies for chronic fatigue, especially if the fatigue began with a case of the flu or some other viral illness. And the Gelsemium fatigue is often accompanied by drowsiness and or sleepiness. If a person is sick and complains of feeling fatigued, I will ask if he's been sleeping during the daytime. If he admits that yes, in addition to sleeping at night, he's also been sleeping during the daytime and not just napping, then I give strong consideration to Gelsemium. The homeopathic literature often emphasizes Gelsemium's droopy eyelids, and regardless of whether that droopiness is associated with a feeling of heaviness of the eyes, or sleepiness, or weakness or paralysis of the lids, we think of Gelsemium in all such cases. By the way, the medical term for a droopy eyelid is ptosis. Another symptom commonly associated with Gelsemium is trembling. Many Gelsemium symptoms tend to involve the nervous system, from fatigue to weakness to trembling to paralysis. Such symptoms are usually considered neurologic symptoms. Gelsemium's trembling is often accompanied by some degree of anxiety, fright, fatigue, weakness, or paralysis. Gelsemium lists in the repertory under nervous trembling, trembling with prostration of mind, trembling with vertigo, trembling of the face, trembling of the tongue, trembling of the extremities, trembling with chill, trembling from excitement, and trembling of the whole body. Now remember that Gelsemium is a remedy for when a trying situation sets a person back on his heels, makes him weak, or causes him to tremble in fright. When we say that he becomes paralyzed with fright, we're speaking metaphorically. However, it's also true that Gelsemium can be a remedy for paresis or literal paralysis. Sometimes there's weakness or trembling associated with incoordination of muscles. Gelsemium's paralysis tends to involve localized groups of muscles or single parts of the body. Just a few of the paralysis rubrics where we find Gelsemium listed prominently include paralysis of eye muscles, paralysis of the optic nerve with blindness, paralysis of the eyelids, facial paralysis, paralysis of the tongue, paralysis of the throat, paralysis of the esophagus, paralysis of the bladder with urinary retention, paralysis of the bladder with incontinence, paralysis of the larynx, paralytic hoarseness, paralysis of the extremities, one-sided paralysis, paralysis in children, paralysis after fever, and paralytic weakness. Additional neurologic symptoms and conditions that can indicate Gelsemium include neuralgic pains, double vision with occipital headache, vertigo, especially occipital vertigo that emanates from the back of the head, vertigo with dim or blurred vision, visual blindness associated with headache, slow accommodation or focusing of the vision, one-sided numbness of the tongue, especially the right side, ataxia, which is difficulty in walking due to weak or incoordinated leg muscles, multiple sclerosis, myasthenia gravis, and Guillain-Barré syndrome. Okay, now, additional physical complaints associated with gelsemium include a keynote sensation of heaviness of certain body parts, especially the legs, but also the head, tongue, or eyelids. Diarrhea triggered by stage fright, anticipation, or bad news. Insomnia from excitement or anticipation. Hoarseness of the voice from fright. Occipital headache accompanied by soreness of the neck with the keynote modality amelioration from profuse urination. Another keynote symptom is chilliness or chills that travel up and down the back. Pain in or below the left scapula is another keynote clue. Gelsemium can also be a remedy for congestive heart failure. And don't forget the keynote symptom of a sensation as if the heart will stop, causing the person to jump up from the bed. The heart symptoms may also be ameliorated by profuse urination. And one last keynote gelsemium clue is sleepiness, oftentimes overpowering sleepiness, regardless of the situation or condition. If the person sleeps all night and then sleeps for hours during the daytime, then we have to consider gelsemium. And finally, so as not to overlook the obvious, let's finish up with acute conditions. Gelsemium is very commonly indicated for a variety of fevers, colds, flus, and viral conditions. And the typical symptom picture in all such cases involves some combination of the following symptoms: fatigue, weakness, drowsiness, droopy eyelids, excessive sleeping, fever, chilliness and or chills, and the all-important absence or lack of thirst. In addition, there can be muscle aches, trembling, dizziness, and or diarrhea. In some cases, there's an obvious trigger, like stage fright, anticipation, or some difficult ordeal. In other cases, there is no such discernible etiology. And lastly, gelsemium is one of the main remedies for cases that have never been well since the flu or some other viral illness, especially when the main complaint is chronic fatigue. All right, let's finish up with remedy relationships. Okay, now, remedies that we want to compare to gelsemium include silica, which is similarly lacking in confidence, can suffer from stage fright, is chilly and aggravated by hot, humid weather, and may complain of weakness or fatigue. Kali phosphoricum fits fatigue and exhaustion, nervous dread, feels unable to cope, is aggravated by bad news, and fits multiple sclerosis. Phosphoric acid is a remedy for mental weakness, fatigue after grief or illness, diarrhea, and a tendency to oversleep, especially in the mornings. Argentum nitricum has stage fright, test anxiety, anticipation anxiety, is aggravated by heat, and fits neurologic disorders such as vertigo, ataxia, and multiple sclerosis. Bryonia can look similar to gelsemium during acutes, but while bryonia lies on the couch all day because it is worse from motion, Gelsemium sleeps all day due to sheer exhaustion. Opium also fits ailments from fright, neurologic conditions, and can be very sleepy. Nux moscata fits vertigo and has many dysfunctional sleep symptoms, including overpowering sleepiness and even narcolepsy. Natrium muriaticum is reserved, is aggravated by the sun, has a time modality of 10 a.m., and fits cases of multiple sclerosis. And finally, cocculus is nervous, anxious, and fits a variety of neurologic conditions such as vertigo, ataxia, weakness, trembling, and paralysis. Okay, there you have it, the Materia Medica of Gelsemium. Thanks for tuning in to the All Things Homeopathy channel. Be sure to subscribe and please let friends and colleagues know about the wonderful homeopathic resource that is accessible to all for free. And as always, may the vital force be with you.